Thank you for joining us for today's session. I'm your host, Debbie Mathias with the BUILD Initiative. We'd like to begin with a land acknowledgement from Giovanna Archuleta, Assistant Secretary for the New Mexico Early Childhood Education and Care Department.
I would like to open up this meeting acknowledging our Mother Earth and the land she nurtures us with, the land where our children grow, and the land that provides the food to feed them. When we talk about these resources, we must also acknowledge the lands of our tribal people and the deep spiritual and long-standing relationship of all tribal nations. Today I come from you from Nambe, the land of my ancestors who cared for it and fought for it so that I may one day live and raise my own children on it. A relationship that predates colonial contact by thousands of years. Our ancestors still speak to us and guide us through our songs, ceremonies, and writings. Through removal, trail of tears, long walks, assimilation, and the idea that by removing children would kill a culture. Our ancestors did not give up. Our tribal people are some of the most resilient people in our country, continuing to raise children to be resilient, who are nurtured through language and culture, the language and culture that cannot be removed. We must also acknowledge all other spirits who were forcefully displaced from their homelands and trafficked for labor and production on sacred native land. All of us collectively continue to experience the adversity that caused our ancestors and spirits who continue to hurt from actions done to them. Take a moment to pray these people find the healing and peace to raise their children in a world that has so many opportunities, but most importantly, create coexistence free of violence. Tribal people are praying people. This is where we are all tied. Our grandmothers and mothers continue to pray over us. And as tribal people pray, they pray for people in the north, in the east, in the south, and the west. They pray for infants, children, adults, and elders, and our non-human relations, each with knowledge to share with us. As this conference begins, I hope that each of you are balanced in all directions and take a moment to appreciate what Mother Earth has given to us and how she continues to nurture us in many ways. I invite and encourage you to learn who are the original stewards of the land you live and work on and support those nations and children of those lands. Thank you.
Thank you, Giovanna. The BUILD team is excited to present this 20 webinars in 20 days for QRIS 2020 as we explore ideas, possibilities, and learn together about how we might recreate better, more equitable systems with children, families, and early childhood professionals at the center of our efforts. We're grateful to the many individuals who took time to prepare sessions, generate content, and ideas to share. We believe the sessions will inspire you to build on these ideas, continue conversations, and innovate back in your own communities and states. We've learned a great deal as we prepared for the virtual event. One of our lessons is that a virtual event draws a much broader audience than an in-person conference. The BUILD QRIS conference was designed for early childhood systems leaders at the national, state, territory, tribal, nation, and community levels. Well, as the registrations rolled in for the virtual event, we discovered many direct service providers, from teachers to center directors and home-based providers signing up for sessions. We welcome you to our learning community and look forward to hearing your perspectives. We encourage you to share your comments, ideas, and questions in the chat box. As you know, we had to pivot from our in-person conference to a virtual conference. We would like to say a sincere thank you to our sponsors who made that switch possible. Their support's essential to this event. Well, we've all become familiar with the Zoom platform over the past few months as we've used it to connect with friends, family, community, and colleagues. We want to point out a few features that may be new to you. First, you can choose your view. In the upper right-hand corner, click on the speaker view to see the active speaker, or click on gallery to see everyone who's on camera. Next, we encourage you to provide feedback throughout the session by clicking on the participants along the bottom. It'll pull up the participant list to the right-hand side of your screen. Along the bottom, you'll see some nonverbal ways to provide feedback. Let's all give it a try. If you see it along the bottom of the participant list, give us a thumbs up, give us a yes, no, go slower, go faster, or show us if you're getting a cup of coffee. Everybody try one. During the session, your facilitators may ask you to provide feedback as they're moving along. Like, do you all agree? Do you know, and that's another place along with the chat box that you can provide feedback. So we do encourage you to be active participants in this session. Please share your ideas, experiences, and questions in the chat box. If there are polls in this session, and there are in this one, a box will pop up on your screen, and we encourage you to respond. This helps us generate more conversation and enhances our learning together. Now I'd like to turn it over to Simon Workman to introduce our session leaders and launch our session. It's all yours, Simon.
Thanks so much, Debbie. Hi, everyone. Great to be with you today. So my name is Simon Workman. I am the Director of Early Childhood Policy at the Center for American Progress, based in Washington, D.C., where my work focuses on early childhood finance, state QRIS, systems work, as well as supporting states and communities across the country with anything really developing related to early childhood education. Very excited to be able to be presenting with you all today and to be participating in this conference in this virtual way. Today I'm joined by two colleagues. So firstly, you see here my colleague Stephen Jessen Howard. He is an early childhood policy research assistant here at the Center for American Progress, and is the lead author on the infant-toddler childcare desert study that we'll spend some time talking about today. And then also joined by my colleague Gina Capito, who is the principal of Prenatal to 5 Fiscal Strategies and an expert in early childhood finance, governance, and systems development, and many, many more areas, and has worked with many states and communities, and including many of you who I see in our participants list. So we have a great deal of expertise with us today, and I'm very excited to jump into this session. So a quick overview on what we are going to be covering for you today on the next slide. So firstly, we all know that access to high quality childcare is challenging, but we are going to be specifically talking today about the challenge to find high quality childcare for infants and toddlers. And so we really feel it's important to make sure that the conversations around how expensive childcare is, how difficult it is to find, how challenging it is for certain communities and for certain types of childcare, but to really focus on the youngest learners and how they have been left behind by the current system. So we're going to start by talking a little bit about the general context around supply and demand of childcare, and talking about the concept of childcare deserts, which many of you may be familiar with, but we'll give a bit of an introduction to that. And then we're going to talk specifically about our new report, which is not even out yet, and you're all getting a sneak peek of some of the results from our new infant-toddler childcare deserts analysis. So you can pat yourselves on the back for joining us on a Friday afternoon in the summer to talk about childcare, that you're going to get to see some great new data. And then we're going to talk about strategies for how you can address these deserts. So once you've identified them, what now? So we'll talk about some of the key strategies that are out there, and would love to hear more from you during that time about how you have used any strategies in your states or communities. And then finally, we are going to spend some time talking about the general system of funding and governing prenatal to 5 systems, and how you can really address the underlying problems that exist in the childcare market, and really come at this from a more comprehensive approach. So to get started, I'm just going to lay a little bit of the groundwork on the context. And on this next slide here, many of you might have heard of this concept of childcare deserts. So this is what we call an area with insufficient childcare. So that is either, it doesn't mean there's no childcare, it just means there is not enough childcare to meet the potential demand. And so CAP developed a methodology a couple of years ago to look at childcare deserts. We've looked at it in a few different ways over the years, at the zip code level, and more recently at the census tract level, which is a much more smaller measure, obviously. And what we found in our most recent study was that 51% of neighborhoods in the United States are what we term childcare deserts, where there is insufficient supply of childcare. And last month, we released an updated methodology with pre-COVID data. So just to be clear, all the data we're going to talk about today is based on a pre-COVID time, and we'll talk a little bit about the impact of COVID. But because of lags in data, we are presenting data pre-COVID. But, you know, of course, there's a way to think about that of, if this is the situation pre-COVID, we know it's only gotten worse with the struggles the providers are going through during this pandemic. But this new methodology we have takes a slightly different look and looks at how close families are to childcare based on a drive time. And so it takes a more realistic approach of, you know, you might be sitting in one zip code, but if there's a childcare provider in the next zip code over, that might actually be really close. So this new methodology takes that into account and says, are you living within a 20-minute drive of childcare? And so it has a more complex understanding of childcare deserts within there. We also were really excited this year to be able to integrate some key census data into the map. So you can kind of look at the map and say, okay, so these are where our deserts areas are in our city or our state. What does our poverty level look like in our city and our state? What does our proportion of children living in families of people of color? What is education level? All these different pieces from census. So you can start to see, are our childcare deserts disproportionately in certain areas? Which you'll not be surprised to learn they often are. So we encourage you to check that out, childcaredeserts.org, which has all of that new data in. But here's the big part. This is 0 to 5 data. So this is all about, we were able to get data from all 50 states, but it is on 0 to 5 childcare supply. Now what that does, and that's very informative, but it does mask some of the variations for specific populations, such as infants and toddlers. So the reason we embarked on this infant and toddler study was to really get a better understanding of, within that childcare supply, which doesn't look good anyway at the 51% in childcare deserts, are infants and toddlers more likely to be in a childcare desert? So that's the study we're going to talk about in just a moment. But before we get to that, we want to ask you a question. And so if Jen can get the question up, you should see a poll question up now. We want to know, do you know in your state or in your community how many infant and toddler childcare slots there are? Is this a piece of data you have? So hopefully you should see a pop-up. I see people starting to put things in. And we'll give people a few minutes to put this in there. Great to see you starting to put results in. And as these are coming in, I'm going to pass it over to Stephen Jessen Howard, who is going to talk about the results when we close the poll, and then talk about the infant-toddler census report.
All right, thank you, Simon. So we'll give a little bit more time on the poll, but I think as the numbers are coming in so far, I'm actually pleasantly surprised by how many folks do say they know how many infant and toddler child care slots there are in their state, given that so many states do not collect and report that information. Okay, so I think we're probably ready to move on. Looks like a little more than half say they are not aware. About 15% maybe, and about a third say they do know. And so that's actually fairly close to what we found when we were looking to find data about infant and toddler child care supply in each state. So Simon gave you a little background about child care budgets as a whole and some of our past research about that. And like you said, we knew there were specific gaps for the youngest children, and we wanted to get data specific to that age group. So we reached out to state licensing offices and early education agencies in every state and asked them and really tried to get this data for every state about what the child care capacity is specifically for the youngest children. And when we say infants and toddlers, typically the age range we mean by that is children under the age of 3. Different states use slightly different definitions. So some states use children who are just 0 and 1. Some have the gap at like 30 months or somewhere in between 2 and 3. But generally when I say infants and toddlers, I mean 0, 1, and 2-year-olds. So in 2018, we did a study that sort of started quantifying this. It included 9 states and DC. This year, we were able to expand the number of states we're able to collect data from to 19 in DC. So a lot more data in it this year. It's about 40% of the country's population in the sample. So clearly, a lot of states still are not collecting that data, and it's really important that they do because of the differences we see between preschoolers and infants and toddlers. But it does seem to be moving in the right direction in terms of states collecting and reporting this data. And I should add that there aren't any states that had data for that we left out. It's every state we could get, we included. And some we did have to do some extra calculations and filling in gaps because there's some states that, for example, don't collect infant and toddler data within capacity in home-based facilities. Or they have different ranges, so you have to do some calculations to figure out who in the 2 to 6-year-old range of the 2-year-old and that kind of thing. So as we'll see in later slides, that can impact the state data a bit. And it's also important to mention that this data collection, as Tommy mentioned, was done before the coronavirus pandemic. So we collected this data in primarily in January and February of this year. As we know, COVID has had a really severe impact on the childcare industry. A lot of programs have closed temporarily, and some are likely to close permanently without additional assistance. We know many that have remained open or have reopened are doing so at a limited capacity because of social distancing and precautionary safety measures. And we know, some providers might not come back. So it's important to keep that in mind. We're looking at the data. This is before COVID, and it's likely going to be lower afterwards, unfortunately. So yeah, I think we can move to the next slide and look at results. As Simon said, we have not published this yet, but it should be out. This research should be released in early August, and so you'll be able to see more details about childcare supply. We'll have all these results available by each county within the states in the sample, and we'll have some more demographic data to put with that. So as you can see, there's really a shortage of infant and toddler licensed childcare. So in total, across the sample, there is slightly less than 1 slot of licensed care for every 4 infants and toddlers. About 24% could be served. You see the variance across states here from about 15%, the lowest in Indiana, to even the best case scenario is less than half of infants and toddlers could have a licensed childcare slot. And we know, not every family needs a slot of licensed childcare for their infant or toddler, but in order to have that option, the slots need to be there, and the numbers are really low across the board. So as I mentioned earlier, there are some differences among how states collect and report this data that could contribute to some of the differences in the state numbers. So that is one thing to keep in mind when we're, I would caution against state comparisons a little bit to that extent. Particularly California, I know, is missing some data from the smallest classification of family child care homes. But you'll see really there's a shortage across the board. Simon mentioned child care deserts earlier and classifying areas as whether or not they are a desert. We haven't quite used that definition as much with infants and toddlers just because there are different needs in terms of demand for infant and toddler child care supply. But about 80% of the counties in the study had more than 3 infants and toddlers per slot of care. So it's really widespread. There were more counties that had no supply at all for infants and toddlers than there were counties that could provide care for more than 2/3 of infants and toddlers. Really, so no matter how you slice the data, there's just a real shortage here. I will also say, if you answered yes to the earlier question and do not see your state listed here, please send us an email and we can talk about maybe being able to include your state's data in some future analysis. But looking at some of the demographic breakdowns as well, as Simon mentioned, in previous deserts research, we've seen areas with higher proportion of Hispanic residents are more likely to be in childcare deserts. Low-income areas are more likely to be childcare deserts, and rural areas are more likely. Some of those correlations were harder to look at with the infant and toddler data because we had to look at it at the county level. And we know that a lot of these disparities are happening within counties. So, within neighborhoods that are higher income or lower income within the same county, that's where we'd expect to see a lot of this. And we were only able to compare across different counties for this analysis. So given that we did not see significant differences in access to child care supply by race or by income, again, that doesn't mean they don't exist, but across counties there are not big differences. We also didn't see a big difference between rural and urban counties, which was a little surprising to us because in last year's study, we did see that rural areas had much less infant toddler supply. So again, that could be something that's partially due to some of the different data collection and analysis methods we use this time. And so, that's something we might need to look at a little more. And then, so does anyone have initial questions about the data and some of the methods?
Stephen, I want to frame up one thing that was raised in the chat as a couple of the participants are looking at the data and reflecting on that question of whether it resonates with their experience in their state. A comment came up that it didn't appear to be reflective, but I think that part of it is sort of interpreting, understanding what that percentage is. That what we're seeing here is that so in Maryland, and if you could kind of expand on this a little bit, that the current supply for childcare could only cover 19% of the infant toddlers in the state who could need childcare. And I think that's an important piece of making sure that folks are interpreting the data correctly.
Yeah,
thanks for that. On that a little?
Right. So, yeah, like if you use Maryland as an example, the 19% would mean like there are 19 slots of childcare that could serve infants and toddlers for every 100 infants and toddlers. So we know, maybe not all of those 100 infants and toddlers might need infant toddler licensed care, but they're just only, if all of them did want it, only 19% of them could have a slot. So that's sort of what these numbers mean. You've also, we also talk about them sometimes in terms of kids per slot. So that would be about 5 infants and toddlers for 1 slot of licensed childcare, if it's about 19% in Maryland. So that's another way to think of it. So really a shortage, yeah.
That's great. That really speaks to the idea of what one of the states raises, that they see long waiting lists. That 5-to-1 really demonstrates that you're going to see waiting lists if there's only one
right.
slot for 5 kids that could need the slot.
Absolutely, yeah. So if we go to the next slide, we can continue talking about some of the patterns we saw in the data. So this graph is looking at the relationship between maternal labor force participation and infant and toddler child care supply. So areas with a higher maternal labor force participation means a higher percentage of mothers with children who are 6 or younger than 6, so like before school age, are in the workforce. So they're working or they're actively looking for work. And so the counties on the right, like 4 and 5 are the counties that have higher rates of working mothers, and the counties on the left have lower rates. And so you'll see the areas that have higher levels of infant and toddler childcare supply, so where the supply could serve a higher percent of kids, also have higher rates of maternal labor force participation. So more childcare supply, higher number of mothers who are working. You know, that's probably not a big surprise. I think we expected to find that. As you know, it's difficult for parents to be able to work if they are unable to find childcare. And we know childcare access is an important part of that. We're looking specifically at mothers. You know, it could be parents as well, but what we found in previous research is that typically the burden falls on the mother in terms of making career sacrifices or leaving the workforce temporarily when there are childcare issues with a family. So does anyone have questions on this? Let me know if so. Otherwise, we can move on to the next slide. So another correlation we found, which is pretty interesting and similar to the last one, is that areas with more infant and toddler childcare supply also have lower rates of unemployment as of May 2020. Now, I think the relationship here is less direct than it is with maternal labor force, just because, you know, there are plenty of folks searching for jobs who do not have young children and are not directly impacted by childcare supply. But we do see, right, areas where there's less supply, more people are out of work. We know, you know, this is data from May that was about, you know, at or close to record levels of unemployment, especially given the COVID crisis. And so, you know, as we mentioned, folks with young children need to be able to have childcare access of some kind in order to return to work. So as we think about steps for economic recovery and, you know, returning to normal when it's safe to do so, one thing that's really important to that is ensuring that there's childcare supply and people who need childcare are able to go to work. And like I said, it's not a direct relationship, but it is an indicator that, you know, areas with higher unemployment could be getting hit sort of doubly by this. You know, they have lower childcare supply. If they have higher unemployment in May, they're probably being hit harder by COVID and closures. And so that those things sort of interact and is going to make it a lot harder for the recovery of the workforce and bringing back the economy when it's safe to do so. So we need to make sure childcare supply is something that's available for the families who need it in order to be able to work when it's safe. So we can move on, but please let me know if you have any questions about that. Okay, so now we'll talk a little bit about why this is. Why is there less capacity for infants and toddlers? So, you know, as I mentioned, part of it may have to do with just a lower demand for infants and toddler childcare compared to older kids. Parents are slightly more likely to prefer, you know, parental or informal care, like with a relative or close friend for the youngest children. But really, the big reasons that that we want to highlight are these structural issues within the childcare market. And so really the biggest thing here is the staffing needs for infants and toddlers and the youngest children versus older children. So if you think about the ratios and what is needed to care for kids who are before school age, when you have a classroom of 4 or 5-year-olds, the ratios are typically like 1 teacher or, you know, childcare employee per 10 to 12 kids, depending on the center, depending on the age, depending on the state. You can have those larger ratios. Whereas if you're taking care of infants, babies, you know, they need constant supervision. It's probably going to be a ratio of about 1 to 3. So 1 provided for 3 kids. The majority of the costs for most childcare programs is the staffing cost. So if you think about it, you're paying the salary of 1 provider using tuition payments from 3 children in a classroom with infants, versus if you have 4 or 5-year-olds, you have the cost of the wage of the childcare provider is spread out over, you know, 10 to 12 kids. So just right there, it really demonstrates why it's so much costlier to provide care for the youngest children. And so a big problem here is that the subsidies and payment rates do not reflect the difference in the cost of providing care for the youngest children versus older children. And that difference is not something that most families can make up. If you think about, you know, childcare is really expensive. Providing high quality childcare for infants is often around like $30,000 a year. It depends a lot on state and salary information, but most families just aren't able to pay that, especially if you think about parents of infants. And there's a lot of increased costs as you add children to a family, you know, buying cribs, stroller, diapers, whatnot. A lot of parents need to take time out of the workforce. You know, the U.S. is one of the only countries that does not offer paid family leave. And so even if you do have infant-toddler care, a lot of times you have to wait till a child is 6 weeks or 8 weeks old before you can enroll them. So, you know, what's the parent going to do during that time if they don't have paid leave? So you have this sort of double wing of increased costs and a need, you know, so you have to, a lot of families have to keep working, but you need to pay for this expensive childcare in order to do so. And it's really tough to make that all work. And so that's where it's really important to have these subsidies that, that can address this. So let's look a little bit about the differences and sort of the mismatch between the increased cost of providing care for the youngest children versus the subsidy rates that sort of don't make up that difference. So here's an example from a cost study we did in the state of New York. And so you'll see here the gap between what the subsidy rate pays and what the cost of providing care for the provider is. So the bar on the left goes infant, and then, you know, on the right you have the older children. And so you see across all the regions of New York included in the study, the cost of providing care for infants is significantly more than the subsidy rate that providers receive for doing so is. So you see this red number here, right? Like in region 3, it costs $6,150 more roughly to provide infant care than they receive for the subsidy. Whereas for if you're caring for a 4-year-old in a preschool classroom, the subsidy is a little bit higher than the cost. And you see that there's a really significant difference across the regions here. And so looking at this mismatch, you can see why providers are incentivized to take in and care for older children, and it's really hard for them to do so for the youngest children. And so, you know, if you're losing $3,000, and of course these numbers vary a little depending on the different type of center or family provider, they'll vary a little bit. But in general, you know, there's a much bigger gap for the youngest children than there is for older children, in which case you might be making a little profit off. So Simon added the link if anyone is interested in looking at that full study. But that sort of demonstrates the mismatch that exists there. In addition to that, the subsidy system, sorry, go ahead.
I was just going to say, this is not unique to New York. You know, we have done various studies on cost of quality in various states. And once you start breaking it down by age, this is the reality, because even though, you know, we've done some data analysis that's found that even though subsidy pays higher for an infant than a preschooler, the average increase in subsidy is about 27% higher for infants than a preschoolers, but the average increase in cost is about 60%. So, you know, that's that mismatch, and where, you know, and it goes down to when rates are set based on market price rather than the true cost, when, you know, parents can't afford to pay the true cost of infant care, so you can't set rates at that level. You have this system where it just really undercuts and disincentivizes providing childcare for those young children. And, you know, what we're really clear about with using this data is to say the answer is not to increase ratios, because we know that high quality infant and toddler care requires those high quality interactions that really need low ratios and group sizes. The answer is that we need to talk about how this system is funded and putting more money into the system.
Right, exactly.
And I noticed that just while I'm speaking, that Diane had mentioned in the chat a New Jersey study that they did from a couple of years ago, which is great, and I encourage people to look that up. But she also mentioned that they made the data available by legislative district as a way to really target when they talk to legislators. That is something we have done with our larger 0 to 5 childcare deserts data in specific instances, kind of where we provided that to groups. And, you know, with this data where it is by county, that requires a little bit more finessing. But one of the things we make this data available. We don't kind of hold it just to ourselves. So once the report is out, we are happy to connect with people and share that data and either help you to do that cut by legislative district, or sometimes we might have the ability to actually help you do that to achieve your goals as well. So that's definitely a good flag, Diane, because I think it is something that can be, everyone's always like, well, tell me about my state, tell me about my district, tell me about my area. And you really can use this data to get down to that granular level.
Mm-hmm. Definitely. All right, so another issue with the subsidy system sometimes is that it often does not provide guaranteed revenue, but it's based on children's attendance. And so when kids are absent, centers can't reduce costs, right? Because again, most of it's staffing. You need to be staffed for the children you have capacity for every day. But if you're not getting paid when kids aren't there, then that can be a problem in terms of the revenue source for the child care provider. Can especially be an issue when we think about COVID and center closures. I know states and there have been measures taken to sort of make up for that, given so many folks had to keep their kids at home and centers had to, and homes had to reduce capacity, but that is definitely something that could be particularly worrying right now, and one reason why it can be beneficial for that to be paid based on capacity or based on contracting, which we'll talk about a little bit later. And so another factor that we found, and that has been talked about a bit and is a pretty complicated relationship, is the relationship between pre-K expansion and infant and toddler childcare capacity. So I want to be very clear and say pre-K is incredibly important. In many ways, it's still very underfunded, and there are a lot of 3- and 4-year-olds and older children who could benefit from this and have not been able to have access, whether because it's unaffordable or there aren't enough slots, or it isn't high quality care. There's a lot of ways in which pre-K needs more investment and needs to be improved. But we've seen a trend in some areas, more states, more cities are introducing more universal preschool programs or expanding preschool programs. And so what we've seen in some of those cases is that children who were in a mixed age facility, so a childcare program that served, kids 0 to 5 or 2 to 5 or whatever their age range was, the children who you see are the higher bars in this graph that are, more profitable for the center are being taken out of that model if they're put in this pre-K program that is through a school or through a separate organization. And so what the child care center or, home-based child care provider is then left with is the youngest children for which the finances work out the least for them, where the subsidy rates aren't matching the cost and where the parents can't meet the cost of providing care as well. And so that is causing financial trouble for some programs, and it's sort of has been a negative side effect in some cases, in which it makes it more difficult for these programs to remain financially viable without the income coming in from the older children. So that's something, again, it's important to expand these pre-K programs, but it needs, states and cities should be careful about doing it in a way that's not going to have adverse side effects on infants and toddlers. And I think also, as we mentioned earlier, if these subsidy rates matched up better with what the true cost of providing was, then I think it would be less of an issue to have, pre-K kids taken out of the models. But given that's the situation we're in, it is something that can have side effects in some cases. I should also note when we talk about, and I've seen some comments on this on the chat, when we're talking about these costs of providing care, this is given existing salaries for the childcare workforce, which, as I'm sure a lot of you know, are very low, and infant and toddler teachers make even less than their counterparts who work with older children. So that can really be, we're not saying we should maintain the status quo on this, but just demonstrating, even though teachers are being paid inadequately, this is still something that's really expensive. It's still something subsidies aren't covering. And so that's something that needs to be addressed.
So Stephen, Diane is offered to give us a bit of an example of what happened in New Jersey with their study and what they did after that. So Diane, great to have you on. Can you share a little bit about New Jersey's experience?
Yeah,
Hi everyone. I wish I was in Disney this week. I have to say, on my feed, it pops up all the previous QRS conferences, with all the great pictures and things we were doing. And I'm like, I want to be there in person. Anyway, so I'm missing you all. Yeah, we did our study back in 2017. And the way we were able to do it is first we figured out how many centers were licensed to actually provide infant-toddler childcare. So we narrowed it down to those that were licensed. And then we actually called all 1,700 of them to find out how many of them actually did serve infants and toddlers, because just because they're licensed to serve, they may or may not have been. And then we narrowed it down from there because just having the licensed capacity number doesn't really give you this full picture either, which led us to ask the questions like, you know, how many do you actually have on a given day? And we kind of broke it down. So we had to have conversations with everybody to get a more accurate picture of the availability of infant-toddler childcare throughout the state. We didn't get 100% participation, but for those that we had some kind of a way of figuring it out. We had some kind of formula for those that we didn't actually get to speak with to estimate it based on what their license capacity was. But the data ended up really being so valuable for us and created a lot of policy. That combined with our cost of quality study led to separating our infant rate from our toddler rate, and then reimbursing infants at a much higher rate than toddlers for regular non-rated centers. But when they developed their QRIS system, because of the data that we were able to have that showed, you know, what you're just showing here about the cost differential, the greatest increases to our subsidy rate on the tiered reimbursement went to infants. So they stacked it so that there was greater amounts of their resources went to really boosting the infant rate so that you wouldn't be seeing some of these things. And the other piece that from the capacity study is that our state ended up using some of the federal dollars from two years ago, I guess, when we got that additional federal CCP dollars. They created an infant-toddler quality expansion initiative where they were giving special grants to infant programs around the state to increase the number of infant-toddler slots that they were offering. So they put $1.2 million into that, into a fund to really enhance the number of infant-toddler slots throughout the state. And what our data was able to do is help them to figure out where they needed to target that work, because they would see where there were lags and problems and really try to figure out how they can target that work. Now, all of that was just starting up when the pandemic hit, and we were in the process of updating our data and getting ready to put out a new report, but now we're holding back because, of course, we don't know what things are, it changes every, we don't know who's coming back, but we will, but we did make sure as of April 1st that we got an accounting of every child care center that was licensed to provide infant toddler care that was still open as of April 1st. We went in and made sure we pulled that data down so we had it so we can make a comparison in November where we land now. So this data is just so valuable, and looking legislatively, that really is what made people perk their ears up. When they heard you don't have any slots in your district, then they were really wanted to hear. And we still get requests for this data from both on the state and federal legislators that really want to see what's going on in their districts. So it really helps to look at it that way.
Yeah, that's great. And I think you raised a really important point that about the linkage between, you know, a strategy to increase supply, but also a strategy to cover the costs of that supply. You know, there is no use just, you know, if you gave everyone a grant to build a new infant classroom, like that's great, but if people can't afford to cover the cost of running that infant classroom day in, day out, then that infant classroom is going to be empty. So, you know, your supply, you know, it's going to be useless. So you have to put the, you know, those increases to subsidy for infants and toddlers is important as well. And so making sure you're kind of like targeting to it's all, to me, is all about data and targeting, right? The more data you have, the more you can target. Like, we all advocate for, higher subsidy rates overall. We should be at least at the 75th percentile, if not higher. But actually, when you break it down, it's like infants and toddlers need a much bigger boost than, an across the board 10, 20% increase. But, you need the data to be able to make that case to legislators, policymakers.
Right. One of the other things we did was we had a map that we were able to take a picture of the legislative districts or the counties so that they could then see it, and then we broke it down by which ones were quality rated as well, so that they were able to see how many, so we broke it down as much as possible, and that data is it's just so valuable. I'm a data geek like you guys.
So Diane, while we have you, you actually did get a question in the chat specific to you on this, to drill down a little. So when you've been, the questions from JJ in Alameda, which is the East Bay in California, when targeting the work, do you mean in specific zip codes or high needs populations, or by capacity to serve, or other priorities as far as targeting?
You mean for our expansion? I'm not sure if they're talking about the expansion initiative.
Yeah, I think so. Yeah.
Right. So when there were areas, we usually targeted cities. So we figured out how many of our cities were infant-toddler deserts. And for those, that's where we did some extensive outreach to the childcare programs in those areas to see if they would have any availability to increase the number of slots in their programs. And it was all tied to quality, though. We also made sure that it wasn't just opening up a slot. You had to go on a fast track through QRIS, so that it was not just opening up a slot, it was opening up a quality slot, which, you were given a boost while you were in the process of getting rated, but that once you were rated, you were getting that increased subsidy reimbursement rate. So it was also tied to that. So it was really, we looked at cities, main cities where there was high numbers of infant-toddler deserts, and targeted that way.
Great. Thanks so much, Sam, for sharing.
Sure.
Appreciate it.
Yeah. Yeah, that was an awesome example of, how you can collect data, even if your state might not report license capacity by infants and toddlers, but steps you can take to, to get that data and use it to drive the needed change. So that's great. I know another state that's done something like that is Colorado, where they didn't have complete data on licensing by age group, but they did surveys with parents and with providers to see what the parents' needs were and how providers were breaking down supply by age and how their license capacity compared to how many children they're actually able to care for. And so they were able to use the results of that survey to model out childcare supply compared to demand across the state. And also had a cost model about how much it costed per child by age range and by geography in the state, and we're able to present that to the legislature. So there are things you can do, even if you look on your state's website and say, oh, there's no data here. There are steps you can take to sort of build that data and use it to advocate. And I'll put the link to that in the chat. All right, so we have another poll for you now. So we want to hear more about some of the strategies you've used or considered in your state or area to address infant and toddler childcare deserts. And so you can select as many as may be relevant in your area. And as you answer, I'll pass it to Simon, who will help break this down.
Thanks, Stephen. And as you see there, there's an option for others, which you can write in the chat box. And of course, if you haven't used any strategies, that's okay too. We're going to talk about some of these strategies in just a moment.
Also, Simon, sometimes if folks are on a tablet, they might not have access to the poll. So if you want to just tell us what strategies you've used in the chat, we can feed that into the discussion too.
Yeah. Oh, and I'll just mention for those of you who maybe are only on the phone, we have a message being shared in the chat box about a similar analysis that was done in Minnesota, and a mapping tool that's available at childcareaccess.org, which is a great tool. We've checked that out before, where they looked at areas of low access accounting for supply, cost, and quality. And they did reports available for the legislative district, county, and other units. And they actually work with the University of Minnesota researchers, who are the researchers that we at CAP worked with for the larger childcare deserts report we put out last month. They were the ones that developed the drive time methodology for the Minnesota report, and we were able to work with them to bring that to the whole 50 states, which required a very big supercomputer working long hours to map all these different drive routes of the millions of different drive routes that families could have childcare. Okay, let me see. So the poll results are up, and so hopefully you should be able to see the poll results now. So the most common strategy used was early Head Start childcare partnerships or early Head Start hubs, but also 45% said they'd use contracting of some kind, alternative methodology for rate setting, and then staff family childcare networks as well, also pretty high. So good to see lots of strategies being used. Early Head Start is definitely a really key one, and we are going to talk about that a little more. In the chat box, somebody mentioned the state task force, which is great. Not sure which state you're from, Tiffany, but that is another good way to actually have people really focus on this issue and use some of the resources of, depending on how that task force might be mandated. We've seen legislative task forces created, which can really actually have some money put behind them. Sometimes they don't, and it's just a matter of like, let's get the data together and, put it out there in a key way. So let's talk a little bit more about those strategies now. If we go on to the next slide. I want to take a moment to talk about some of these strategies. And one thing to acknowledge as we go through this is a number of these strategies have maybe been used somewhat sparingly until COVID. One of the things we've actually seen with COVID is that some of the emergency responses that states have moved to have actually been things that we have long argued should be changed in the early childhood system anyway, such as, as Stephen was talking about, such as if you wanted to pay subsidies based on enrollment rather than attendance, if you wanted to actually pay at the cost of quality. What we are seeing in some states is they are implementing those policies. They have set up emergency childcare grants based on actually what it costs to provide childcare at the lower ratios or the lower group sizes, of emergency childcare regulations. So there is kind of this interesting moment right now where potentially we are like laying the groundwork in some states to show how these strategies can actually be helpful and kind of normalizing the idea of continuing to do these strategies even in the post-COVID era. So the first one we have here is contracting. And so grants or contracts, the idea behind grants or contracts is instead of paying subsidy based on the type of voucher at the moment that is a sort of portable voucher, if you like, where providers receive the parental co-pays and the subsidy payments based on that individual eligible child, who comes to them. And providers get paid directly by the subsidy program, but that basically is really dependent on whether you have somebody, whether you have an eligible child come in to your program. So you can imagine that you might have a slot that is available, and somebody who is subsidy eligible comes and takes that slot. But then if they leave, you could either, there might be another subsidy eligible child available, or there might be a tuition paying child available. And depending on where people are on the wait list and how you manage that, that subsidy slot could very easily disappear when the original recipient leaves. The idea behind contracts or grants, either in a childcare center or in a family childcare home, is that there's an agreement between the subsidy program and the childcare provider to designate a certain number of slots for subsidy eligible children. And the provider basically agrees to keep that number of slots available for the period of time of the contract for children with childcare subsidy. And what that means is that if a child leaves who is subsidy eligible, the provider then recruits another subsidy eligible child to go into that slot. So you have this kind of stable supply of subsidized childcare. Now, for the provider, what normally happens is you might get an increase in the subsidy rates through the contract, or the benefit for you is that you have this kind of somewhat guaranteed income because you aren't just kind of waiting for the next subsidy slot to come. When you are filling that slot with a subsidy eligible child, you are getting paid for it. And there is a grace period normally between if a child leaves and it's 2 weeks before you fill, you are still paid for that contract. There's normally kind of a cut point in there. Georgia is the one of the prime examples of a place that's used contracts very successfully. And we have an issue brief coming out in a couple of weeks that's actually going to specifically look at Georgia's contracting program, which will be coming out alongside the infant-toddler deserts report. And then the other piece on here is alternative methodology for rate setting. So we've talked about this a little bit, the idea of how you set your rates. So, when subsidy rates are based on price, not cost, because providers are charging what the market can bear, not what it really costs. Providers really cannot afford to charge, in most places, what it truly costs to provide infant care because families just cannot afford to pay it. So what does that mean? It means your market rate is low. So when you report the market rate survey, your rates are low, so your reimbursement is low. So, there really becomes no incentive for a provider to provide subsidized childcare to infants and toddlers if the amount of the subsidy is only covering, say, 50% of the true cost. Whereas if you enroll a 3 or 4-year-old, you could be covering 80% of the cost. We should be covering 100% of the cost, but that differentially, as Stephen was showing on some of the other charts, is much worse. If you set rates based on this alternative methodology for rate setting that is now allowed under the CCDF rules, you're really aligning what it truly costs and doing that based on if you have different ratios for children under 12 months to 18 months, then you should have a different subsidy rate for that because the subsidy rate should be aligned with the actual cost drivers that are driving that. So, by doing a study that actually looks more into the true cost, you can start to address some of the financial disincentives to providing infant-toddler childcare, which can then help to ultimately get the supply-demand market to start working again. Once people actually can afford to pay for it or there is a public investment that is covering the cost of it, the supply will start to increase because providers will be able to be compensated for those slots. They're more likely to make those slots available. And that's something that not many states have done right now. The District of Columbia is the only place that actually has fully implemented alternative methodology. But there are a lot of states that are looking into it, that have been integrating it in some way to their market rate study, even if they haven't completely moved over to it. So I certainly see this scenario we would expect to see a lot more states moving to in the next few years. And something that we've definitely seen during the COVID period where people are asking the question, what does it really cost to provide childcare that meets these emergency regulations? Well, if we're going to sort of start addressing that now, let's continue that once we get back to some semblance of normality, whenever that might be. So the next big one on here, which a lot of people mentioned, which is great, is the Early Head Start Childcare Partnerships. I'm going to pass it over to Gina now, who has a lot of expertise in these areas and in the Staff Family Childcare Network, to talk about those particular strategies as well.
Thanks, Simon. So we're going to unpack Early Head Start childcare partnerships a little more. As Simon noted in the poll, there was a large percentage of you that had explored or used that as a strategy for addressing infant-toddler supply. And there's several features to the approach of Early Head Start childcare partnerships or using a hub approach to serving and working with providers in that capacity that make it a really viable option. I mean, of course, for states and communities who have been able to pursue the Early Head Start childcare partnerships funding that started back in 2014, and we've seen a couple of rounds of, and we're all actively waiting here for in 2020. So pursuing new funding, right? That's a great way to address supply because if you get new dollars in, you can then take the enhancement that comes with the federal Early Head Start funding, and then partner up with childcares in communities. Use some of your desert data to really think about where you build those partnerships and whether you build center-based partnerships or family childcare or a combination of both of them, to then push in more resources to the providers, possibly encourage or incentivize providers to open up slots to infants and toddlers where maybe they previously served infants and toddlers and they stopped serving them because of the high cost and the difficulty in meeting regulations. So you sort of incentivize and offer them the support structure. It also offers them the additional, not just the dollar resources, but the additional support structure of access to being part of a network that's implementing the Early Head Start grant, which can be really beneficial for especially small centers and family childcare homes who often are pretty isolated in communities. And this brings them more into the fold and supports their quality. So certainly that's a way for new slots and increasing slots. We do know, of course, also that the Early Head Start dollars pushed into programs as can be a real benefit to increasing the quality of current slots also, which, while we're talking more about deserts and supply, I think we always want to have in the back of our mind not just the idea of how we are continually addressing the quality of the care that's delivered to young children, but how are we supporting providers in that work so that we don't lose them, particularly when we talk about infant care providers. They may be, and we may not even realize how much they're on a fault line, and that any small thing or really big thing like a pandemic could cause them to decide that they can no longer deliver care to infants. And we hear this story again and again across the country that I used to serve starting at 6 weeks, and then I went to 18 months and older, and then I just recently moved to only serving preschool age children. And so it always feels like it was a moment that we missed an opportunity to support someone in their capacity in a way that might have kept their services for infants and toddlers open. And Early Head Start is an opportunity for that too, when you think about the idea that you may have providers out there in your community who do have classrooms for infants and toddlers, and that by pushing in the additional resources and that support structure, it may allow them to continue to be that resource for the community in a way that they might have been on the edge themselves or really struggling. One other piece of this particular strategy is that we also see states really understanding the benefit or the opportunity that comes with it and doing lookalike models. So it's not always just about whether there's new federal resources and can I implement the partnerships approach using the new federal resources, but there are states, and in particular Oregon comes to mind as a state who has been using Early Head Start lookalike models for several years, and the partnerships approach is another way to go about it, because you take all of the good of the quality standards that come with the Early Head Start delivery, and when you're implementing it using your state funding or even more local funding at a city or regional level, you have the opportunity to serve families that are maybe a little bit higher income, since the Early Head Start federal regulations, you serve families at 100% of the poverty line and under. But we know in many of our communities, especially our urban areas, families are, in order to even be able to live in the area, they're earning a little bit above that, but they're still living in poverty. Making 150% of the federal poverty line for a family of 4 is still living in poverty. And so when you're using more your local public dollars at the state or local level, you have the opportunity to tailor how you implement in order to broaden the net of families that can then access that program, which may be even more appealing to the child care providers in the community when grantees and folks that are seeking to implement Early Head Start go forward and go build those partnerships with centers and family child cares. Sometimes it's a little bit daunting, all the regulations that come with them. So being able to be a little more nimble or responsive to community need in that way around the families that get enrolled can be a way to make that a little bit more appealing as an approach. And then if it's not an Early Head Start childcare partnership kind of in that strictest way of thinking about it, then there's also just thinking, and that's why we included this concept of Early Head Start hubs, or comprehensive hubs is often a term that you may have heard or be thinking about, is an idea of thinking about how, and it's similar to staff family childcare networks, but I am going to discern the two before we move to that last bullet, that part of what we're doing there is thinking about small centers and programs in communities that are on their own. They're not part of a large nonprofit or a large school district or entity, and they're operating on their own, and there's a lot of benefits to them being organized into a hub, and some of it is sometimes you see shared service supports like HR support, payroll administration, enrollment administration, things that can be done at a back office level and then support multiple sites through that approach, and then you're going to get some benefit of the cost. You know, everyone has to administer payroll, but when we administer payroll for 10 programs instead of each program having to build the structure and administer it on their own and pay the cost, you're going to share those costs differently across those 10 sites. There's a lot of things around the quality of services that, again, can be pushed in through those hubs, like supports for infant mental health consultation, supports for the teaching staff, like a mentor coach teacher, and having that additional support for, and if you run a small center or a family childcare, you're often very alone in that capacity of trying to have that sort of reflective supervision and teaching and learning, mentoring that you can have when you're part of a bigger organization. Hubs are a way to get the benefits of a bigger organization and still allow community-based providers to function in their independent way. And this too may be one of those examples where it incentivizes someone to consider offering infant toddler care where they might not have otherwise, because they know that they're getting certain benefits by participating in a hub, or currently providing infant and toddler care, continuing to fill that role in their community, because by partnering up in a hub, they've gained access to benefits that they wouldn't have had otherwise, and maybe made it a little bit easier for them to administer that programming and access hopefully some of the funding related to that programming. Any questions or thoughts about early Head Start childcare partnerships? I see Simon threw a question in there if folks had any strategies and want to share their experience. So I'll pause for a second, see, before we move on to talking about networks. One of the things that networks, and why I said I did, of course, want to talk a little bit about the concept of staffed family childcare networks separate from the idea of early Head Start childcare partnerships or hubs, but also want to relate when we think about some of the issues that Stephen raised around why infant toddler care is frequently not delivered as often as preschool care. You know, there's a lot of variables to it. And that access to stable or consistent funding is certainly one of the biggest, because with it costing so much more than it costs to serve preschoolers, if you have a variance in and your revenue for the infants that you're serving is tied to whether a family takes the voucher and kind of moves on, or your ability to manage implementing the voucher, then that puts you, it's a much more precarious position to be in running a business. I think we would all acknowledge that when we think about like what makes businesses run and thrive. And both the early Head Start childcare partnerships, of course, because those in their strictest sense include federal funding to the sites, but hubs and networks have the opportunity, as one of the things that they may do in partnering up with the providers in the communities, is to really think about that enrollment and administration of funding and bringing in, so being the source that enrolls the child and family, determines what funding streams they qualify for, and then actually does the processing of the payment and the processing so that the provider then gets paid, you know, their monthly voucher amount, or in the case of, if there's contracting, even more of a slam dunk. But there's still that benefit that by being part of a network or a hub, if that's one of the services that the entity delivers, that can be a big benefit to the providers within it, because it takes some of that administrative heft off of the provider and allows them to continue to focus on the managing their staff group, as well as them providing care to children, particularly in the case of our family childcare providers. So we want to highlight that it's not just as simple as saying that when you join a hub, there'll be more supply for infants and toddlers. There's a variety of things that go on in those settings that increase the likelihood of someone continuing to provide the service, as well as being enticed to consider offering infant and toddler care, because they're getting some supports that address some of the barriers or reasons that make it really hard to be the one delivering infant toddler care completely on your own. And so to move on to staffed family childcare networks, and I was messaging with a colleague that is here with us today who is like on the cusp of launching her staffed family childcare network. So I won't call on you directly, Elizabeth, but you're welcome to share how exciting it is for you in Arkansas and what you're working on. But one of the things that we were talking about was the stage that they're in and engaging with providers. And one of the reasons that why staff family child care networks are such a valuable resource for family child care providers is because they are very uniquely tailored to that particular modality of care. They respond to, and even across a given region or let alone a state, can look different for the different providers. So there may be areas of the state where the providers are part of a network or a body that administers their child care food program. And if you're working on building a staff family child care network for that region of your state, then one of the functions of that network likely wouldn't be the administration of the family food program, because providers already have access to the food program and they've already got that funding coming into their program. But there may be another part of the state where that is not a benefit. There's no structure in place in that region that administers the child care food program, and so that may be something that you do want to build into what the network does for providers. And that's the real uniqueness about staff family child care networks, is that you can use the parameters of being a capacity building and support infrastructure for family child care, but then tailor it to the unique needs of the individual family child cares. And while this is, again, one of the strategies that may be about existing providers and how do you engage existing providers in having more access to supports than what they currently have when they're kind of out there on islands operating as family child cares, but it's also can be a great opportunity for possibly bringing online new providers. And that's part of what Elizabeth and I were just messaging about. And there's, of course, family, friend, and neighbor or unlicensed care settings, which many of you as state leaders are actively trying to make sure they're engaged in your health and safety trainings and systems. But there's also a great opportunity to think about that there may be folks out there that are interested in family child care and they sort of don't know where to begin. And so there's a lot of opportunity for education and outreach that can come with having staffed family child care networks. And what we want to do is think about the potential of that strategy. And since Elizabeth shared her video and went off mute, I think that she's willing to be put on the spot to tell us a little bit about the exciting work that you're engaged in. Nice to see you.
Nice to see you too. It is exciting work, and one that I feel like is going to make a huge difference in Arkansas. We have lots of great folks doing lots of great things. And we want to support them in any way that we possibly can. I've listened to lots of conversations during this pandemic, and my heart just breaks for those that are getting left behind and falling through the cracks and those kinds of things. And so if we can figure out ways to support them in Arkansas, that's what we're going to do. And finding those that are unlicensed and unregulated and finding out why. What can we do to bring them over into the fold and support them? I'm learning it's zoning and fire issues, lots of different reasons. But even if we can enhance the quality within the home and make sure that the children are safe, it doesn't, in my opinion, it doesn't mean that they have to be licensed, I guess. I know that's probably taboo, but I feel like if we can build that relationship with them and we can show them how beneficial it is to be on the in instead of the out, that we can change the trajectory of some of these homes in Arkansas and help them to see it is a business. I'm learning that some of them don't consider it a business. They consider it just a way to make some extra money. And so you're messing with people's lives, children's lives, and we want them to have the best care that they possibly can. And my children were raised in family child care homes, and I have 3 very educated, very well-rounded, very great people, mothers and missionaries and different things. And so I feel like that they got a good start in family child care. So I want to support that as the network advisor in Arkansas, and just looking at what we can share services on, what we can do to help one another, because we're stronger together than we are apart. And so it's exciting. Just barely got our feet wet. A lot of research, a lot of webinars, a lot of listening to the powers that have already done it, and hoping that I can tag on to some of their coattails and not make some of the mistakes that have been made before me. So I'm anxious to be here, and I will take any resources, and I've been copying all of those links into a Word document so that I don't lose them when the call's over, so that I can go back and do some more research. But thank you for your work that you're doing, and I just really appreciate all that you guys are doing for family child care.
Thanks for sharing. Yeah, we appreciate that. And many of these tools are also available through the Build's website and other places on Build's website, but also through the QRIS. So you don't have to be trying to actively manage a Word file at the same time as your Zoom platform to make sure. And thanks, Danielle, for sharing the link to the chat box. So we'll make sure you get because there's a lot of good sharing that's happening across other folks too, you know, not just Simon and Stephen and I, but there's other folks sharing resources too. One of the things I want to highlight about staffed family child care networks before we move away from is just because I do think it's a really important thing to reiterate around funding is stability and access to funding. That can be one of the things that staffed family child care networks can really offer to family child cares, and that they may not have thought of, or they've had previous experiences with accessing subsidized care and have found the process to be onerous to administer on their own as an individual, or have found that they get a family enrolled and then the family doesn't start, and so they never really actualize or never realize the funding, and so they, you know, sort of may have been burned in the past. And that what a staffed family child care network, while some of them do the full enrollment and then administration of the funding, which is sort of the Cadillac of services, but then some of them just really support when there's an opening, they have a pipeline of families that are available, and they try to move those families very quickly to family child cares, or make sure families are aware of the ones that do have openings, and there's less lag time for the family in getting enrolled and less lag time for the provider where they're without revenue when they're in a non-contract based system. And so there's some real benefits to it, and there is a continuum of how it can get done, and we wouldn't want to assume that it's like it has to only be done one way within the network in order for the provider to feel the benefit of it. There's actually some continuum. And to Elizabeth's point, this is their business and sort of their passion, so sometimes they don't want to give up certain pieces of it. And so they may approach a network or a hub with some trepidation initially if they feel like that they have to give up certain things that they really feel like are their responsibility or what they got into the work for. And so you want to sort of find ways to meet them where they are within implementing the network, or help them to build the relationship, to build the trust, to give over things like enrollment if that's an area where they don't feel comfortable with. And so I think Elizabeth's example is great about that. Even for your unlicensed providers or folks that maybe aren't interested in becoming a licensed home in the state, you're building a relationship, you're exposing them to resources, and there's a good chance that you're building some real trust there that could generate into more partnership in the future. Any other thoughts on different ways to address childcare deserts? Anything else that folks want to share? I'm going to pivot us a little bit then to broaden out our thinking into acknowledging that this particular, this issue, and I think that some of what Stephen shared earlier about the interplay between serving preschool children and infant-toddler children starts to demonstrate the idea that this is not an issue that's only about infants and toddlers, and that as we think about it strategically, that we need to be thinking about the comprehensive approach that we use as states and communities to serve families and young children. And so the next slide begins to explore some of this concept, this idea of what are the broader issue areas that we are trying to address as we really drilled down and talked very specifically about infants and toddlers and the deserts that are presented in our states, because it is such an acute issue, and obviously an acute issue that's been made worse with the pandemic. But we also know that as we go about this type of work, that functioning at much more of the systemic level and really thinking comprehensively about the approach and the solutions is going to be needed to really fix it. It's not, we can't just fix infant-toddler deserts by only thinking about a single solution, because it's in likelihood not going to meet all of the needs, and there's so many different strategies that could be reflected for different service populations, center-based versus family childcare, and different communities. And so we acknowledge that, of course, at the most basic level, but then we also need to really think about what is broken about what we're trying to work within, and how we often are trying to put band-aids on things that are broken when we really need to stop and think about a much more comprehensive, holistic, and system change approach to really move us on the work that we're trying to do. And early on in the chat, the question about the idea of setting rates with what it actually costs to deliver services came up. So you all are there. Like you're beyond the like, what's broken? Let's talk about what we need to do to fix it. And that's part of what we want to approach with this idea of thinking about a comprehensive fiscal approach. Part of this is that big picture thinking that sets a North Star. So we know that we want to address the fact that there are deserts in infant-toddler care in communities, and that there's no doubt that we need to address that issue area. But we also need to think about then what is our North Star for children and families in our state that's bigger than that as well. There's the access to care, certainly, and there's the fact that certain communities are further from access to the care that they need. But we also know that we have things like very significant issues around equity that are made worse by the market rate and the fact that it's based on price and what families can pay. In communities where families cannot pay as much for care, or often communities where there's more risk factors and further from opportunity, those things are perpetuated by a market rate approach. And so we need to be thinking about how we're going to remediate and go directly at those sort of structural and institutional inequities that we know exist. And we can't do that just alone on thinking about infant-toddler childcare deserts. We need to be thinking about the overall issues that are underlying how we got to those deserts, and then what are some of the solutions or remediations for those issues. And so it becomes a much bigger issue than just the things that are facing infants and toddlers, but we see it very acutely with that particular population. And so we need to be thinking about that systems approach to how we finance things for prenatal to 5. We need to acknowledge that decisions around how we finance preschoolers have impacted infants and toddlers. And so while we're not saying don't do universal pre-K in states and don't have that be a school-based strategy, but when that happens in a state, or when a state's approaching and thinking about that, how is that going to impact their community-based providers who have been balancing their budget for maybe 30 years on a birth to 5 service population, and they're suddenly going to see a drop in their 3- and 4-year-olds, and sadly, they made money off of their 3- and 4-year-olds, which sounds like such a backwards concept in our world around the idea that we make money on any of our children. But that's the reality of how they've been able to balance their budgets. And so, again, it's not saying that we don't go that route for pre-K within a state, but it's then thinking about those consequences and how are we going to have strategies. And that's, again, back to this idea of having a North Star, having a much bigger vision for what we want for children and families, and how we actually have a financing approach that supports and drives us towards that much bigger vision. And so the next slide then starts to think about some of these, and I'm going through this pretty quickly at this point, but again, you're going to have these resources. It starts to raise up some of the principles that we hope to see and need to begin really understanding how they are commonly held, if they are commonly held within our state and communities, in order to begin working toward a comprehensive approach for financing and then governance and governing our prenatal to 5 system, because we know these things are directly related. It's not just a matter of whether or not there's more money in the system, it's also how that money is administered. How do programs access the funding in order to serve families? How do the approaches to the administration of the funding address the inequities and those institutional elements of racism that we know are in place? How does our financing approach actually address that? And then how the money is administered address that? These things are all completely tied together. And that's why it's important that when we think about how are we going to approach the issue of an infant-toddler desert from a more global, comprehensive approach, that we stop and also do some work around whether or not these are shared principles. It's somewhat easy to look at the list and in many instances find that I think everybody would agree to this. The reality is that when folks have to begin to make changes to how they operate, to how their system functions, or function differently within a shared space together, that's where then sometimes these concepts are even harder, become much harder to put into practice. It's easy to agree with them in theory. It's the practical end of carrying out some of this work, and that's where the deep work takes place. And so as we push for state leaders and folks like you who are already there with some of the issue areas and knowing some of the pieces of how it's broken and trying to work on how do we actually fix things at that really systemic foundational level. We push for folks to look at a set of principles like these and really begin to think about how would you bring along a group of stakeholders that are concerned about the best possible outcomes for children, very young children and their families, to get on the same page with these, to really be pointed in the same direction toward a North Star and really have these guide decision making and acknowledge that in places where, say, you begin to understand more of those embedded social inequities, that then you understand the deep change that has to happen to actually remediate it, and then work on, then start forward on a plan that actually does it, start to carry out the activities, because that's what, in that one in particular, is very careful to include the idea of not just acknowledging, but implementing the changes, because those changes aren't going to be easy, and we sort of acknowledge that, but then often don't get to the change agent part, right? We kind of focus on the acknowledgement, but then don't get to the deep work of it. And so we share this to support you all in thinking about if we were to start in a conversation that really started to help us think more comprehensively about our prenatal to 5 system and how we finance it and govern it, these would give you a bit of a roadmap to begin thinking about what are the things that I need to be gathering stakeholders together around conceptually and get folks kind of going into the right direction for doing the work together, and acknowledging how deep and long-term the work is, that this isn't the type of work that you get, 6 months of funding for a task force and think that at the end of it, you can be like, and we solved all of our prenatal to 5 financing. That this is some deep systems change. And I think that those of you that are in leadership roles within your states would acknowledge that it's not like you haven't made some run at these things in the past, but it's that real comprehensive nature and the types of stakeholders that need to be brought together to really focus on the systems change that can be the piece that it can be a bit of a hurdle, and we want you to have a bit of roadmap that supports you to begin thinking about the work and how you might carry it forward. I saw that Simon shared a link to more resources on this idea of the comprehensive approach to financing and governing. So I'm going to wrap my part up there and pass it back over to Simon for the rest of our content.
Thanks, Gina. And yes, I just tried to share some of the links. Hopefully they come up okay, and we'll make sure they're posted properly with the chat at the end of this. I'm going to, this slide here just provides a bit more resources. The CAP Early Ed website there is where you will find the Childcare Deserts report when it comes out in a couple of weeks. And we can also work with Bill to make sure that everyone who participated in this session gets a copy of that as well. So thank you all for your time. I'm going to pass it to Debbie Mathias now to wrap us up.
Well, thank you. Hey, before anybody hops off, we'd like to get some feedback about the session on today's webinar. Some poll questions are popping up on your screen very soon, and let us know in the chat box what was useful, significant, or new, and how we could improve the sessions. It sure was a great session. So many details, resources. We'll post all of those for you, but I'd really like to sincerely thank our session leaders today for this interesting and informative opportunity. We appreciated all the contributions from the participants in the chat box, and we'd like to ask you to continue to share resources, share ideas, give us some feedback, and Simon, Stephen, and Gina, thanks again so much for all your preparation and deep expertise you shared with us today. I saw some folks in the chat box asking about how they could get more information, and Gina and Simon's and Stephen's emails are on the last slide of this. You can reach out to them directly if you're interested in more information about, how your state might do a mapping or assessment, or get a better and stronger understanding of care for very young children within your state. Well, thanks again to you three. People keep going on the poll and in the chat box, and thank you so much. Till next time, bye.